Yeah, I've been involved in the Patient Online programme for several years, and over that time we've been working with GP practices to make them more comfortable with opening up their records for patient access, with making appointments available online and repeat prescriptions.
And what we're trying to do with digital is to offer alternative ways of people to receive health services. The face-to-face model is what everybody's used to, but other industries have already used and adopted a range of digital services. So things like online banking, a lot of us already use those services. And Patient Online is just the first steps, the baby steps from the NHS moving into that world.
So this service allows patients to better manage their time by ordering their prescriptions, booking appointments, and actually then frees up time at the reception desk of the general practice because you're doing it in an automated way.
I'm a junior doctor and I'm very interested in how we can manage demand because the health service is under increasing pressure. As we know, as a junior doctor, we feel that at the front end. So I'm very interested in how we can take the health system forward.
You know, some of the agendas we've got around demand management, demand and capacity management of the NHS, particularly in the context of winter pressures. Things like being able to prescribe in advance 4 or 5 repeat prescriptions for a patient over the course of the winter could be generating 4 or 5 new appointments for a GP in a really pressured time period. So there's huge benefits to the NHS's ability to cope when it's under pressure if people start to take advantage of these services.
How do we try to change the clinician's behaviour and get them to embrace and adopt new technologies?
It's been quite a difficult journey because GPs have been very wary about giving up some of the control that they've got over their record systems. And we've been working very closely with a lot of practices to try to get them to understand the potential benefits and overcome their fears.
We've been doing this at our practices for about 3 years now, and over the last year have been working really closely with Health London Partnership. We've got a Darcy Fellow involved and really helping explore the benefits that this brings to our patients and also the efficiencies it brings to the practice, because it definitely brings efficiencies to us as general practitioners. Ever increasing demands, and it helps us to manage them in a more efficient manner.
We've been working very closely with individual practices and also working through Health London Partnership, really to try and set some achievable targets for practices around the number of patients they sign up for the online services. So currently we're working towards a 20% target of patients being registered, but also, and probably more importantly, making sure that we've got enough appointments available online so that when patients go and look online, they're able to find appointments and find availability. And that's often been one of the biggest challenges. Practices are very concerned about losing control, giving over that control to patients. And we've often had some very difficult conversations with practices, but I feel we've made quite significant headway. And the vast majority of practices are now quite happy to work with us and look at how they can improve access.
The big thing that I find is the clinician's behaviour, and how do we try to change the clinician's behaviour and get them to embrace and adopt new technologies, which actually I feel now is very important. I'm getting to the tipping point within town hamlets where these clinicians are actually now starting to feel the benefits.
We've always been fans of allowing patients to book appointments online, order repeat prescriptions, register, and they can now even consult online with us. So they've got access to that across all of our 15 NHS GP practices, and it works really well. Patients absolutely love it.
I feel that there is a lot we can do to transform the way that we deliver services to patients. We've seen a lot of benefits in both the banking, airline industry, particularly around the way that we interact with the services. And I believe we can bring some of those benefits into primary care.
GP online services, as it's been going for a couple of years, really is gathering excellent momentum, and further features and functionality will be available to patients very soon.
We need to make sure that we don't lose the important doctor-patient relationship in the process, and I think we can make the administration of those services a lot more efficient.